Hello, Dr. Vicki Peterson here. I want to talk to you if you're a soon-to-be mom or planning in the future to be mom. You already are a mom. This has to do with nursing. And I think most of us know that nursing so far outweighs using any type of formula that it's indisputable. But some new research came out that is very interesting, and I think every woman should know about this. We live in an interesting society. I nursed my children, and I was very fortunate, and I appreciate the fact that I could have my children here at the office and nurse them whenever they needed to be, and a little bit of waiting time in between patients, but I didn't have to pump. I could have them with me, and I did that. So I understand that not everybody is as fortunate, but that really kind of speaks to part of the problem, that we don't appreciate how important it is to nurse, let alone how important it is for that baby to be on mom's breast. So an interesting thing occurs toward the end of pregnancy, and that is that a certain bacteria, it's called the bifidobacteria, in the gut really proliferates, and they feel that it's sort of triggered by the hormone progesterone, which also very much proliferates. A woman has at least 200 times the amount of progesterone by the end of her pregnancy than she normally does. And progesterone is the mellow, feel-good hormone. So they talk about sort of the nesting instinct that comes toward the end of pregnancy, and that's a lot of that is propagated by this mellow, feel-good hormone progesterone. But having a good amount of progesterone also causes this proliferation of this bifidobacteria that then, amazingly, not only does a child upon birth get exposed to bacteria by going through the birth canal, also being on mom's skin, kisses from mom, so from mom's mouth, the baby gets bacteria. But actually what happens is that this bifidobacteria comes up through the lymph system and out through the breast milk to help allow baby to digest breast milk. So there are certain sugars in breast milk, they're called oligosaccharides, but they require the bifidobacteria to digest. So it's this wonderful balance of this proliferation of the bacteria in response to and readiness for breast milk, and allowing the baby to digest the breast milk. And also bifidobacteria is known to be a very, very healthy bacteria, that there's less obesity associated with it, less heart disease, diabetes. It protects against diarrhea. What else does it do? I have a little list here. Oh, it helps digest fiber, which is very important. It helps produce vitamins. It makes what's called short-chain fatty acids, which are anti-inflammatory. So it's a very, very important bacteria. So setting baby up with a healthy microbiome or healthy gut bacteria, it's everything. And if you're not nursing, that doesn't happen. The other interesting thing, and this is not to make any moms feel bad, because certainly if you're choosing between pumping versus formula, no decision, pumping hands down. But they did find a difference in less of these bifidobacteria with pumped milk, which is interesting because it's still the milk, but whether it degrades over time, the research hasn't sort of come to grips on why, but some bad bacteria in the pumped milk and not enough of the good bacteria, the bifidobacteria. So whenever possible, that baby right on the breast is the very, very best, if at all possible. Also, mom being on a healthy diet, so she's got a healthy microbiome, avoiding antibiotics whenever possible, low sugar diet, mom exercising, being hydrated. Hydration is everything when you're nursing. I mean, we all need to be hydrated, but I find women who start to lose their milk supply, either too much stress, too much work, not getting enough rest, and also hydration is a very big one. Another thing, recently I had a patient, she's Asian, and Her doctors were trying to talk her out of nursing, saying that her baby wasn't gaining enough weight rapidly enough. And the facts are that the baby's Asian, he's got petite parents, and he's really fine for his heredity, basically. And Caucasian babies tend to be bigger than Asian babies. It doesn't make Asian babies unhealthy. So sometimes this criteria or yardstick that's being used and making moms feel guilty about not producing enough milk, or your child's not gaining weight rapidly enough, it's ridiculous, because the health benefits of that breast milk, it cannot be stressed strong enough how important that is. So don't be talked out of it. If your milk supply goes down, it can go back up again. Babies have growth spurts, and it can be tough. I nursed 3 children for over a year, and all of a sudden they're just sucking you dry and crying because they're going through a growth spurt, and you can feel a little guilty, but all that sucking then produces an abundance of milk. And if you're a mom who's lactated before, you know what I'm talking about, and all of a sudden it's like, oh, okay, now I got enough milk. You could nurse twins, women do. So it's really a supply and demand, and the more they suck, the more milk you produce, as long as you're getting your rest and you're hydrating and all of that. So I'm not saying there aren't those rare occasions where moms really have trouble, and my heart goes out to them. But if there's any way possible for you to breastfeed your baby, and if there's any way possible for most of that to be that skin-to-skin contact, really, really push toward that. So if you're a grandma, you can tell mom, and if you're a soon-to-be mom, I hope this data is important for you, and really, really take it seriously, doing everything you can to nurse your baby, because it makes such a huge difference, and we keep learning more and more about that microbiome. But they say that the bacteria in the baby's gut in the first 2 years of life can really tell the tale for whether they'll have any obesity problems or diabetes, asthma, autoimmune diseases. So it's very, very important. If you are a new mom and you're having trouble producing enough milk, let us know. We're happy to help in that regard. Or if you're a pregnant mom or about to become pregnant, and you want to make sure that microbiome of yours is as healthy as possible, not just for you, but for your baby, let us know that too, and we're happy to help. So reach out to us for a consultation. The telephone number here is 408-733-0400, or contact us via the website, Root Cause Medical Clinics, that's with an S.com, and I look forward to speaking with you.